Today we'll be having CEO Esther Munoz. She'll be speaking on general case updates as well as some vaccination updates and some COVID-19 precautions. From there, she'll take some questions. All right, CEO, give me 1 second. Whenever you're ready, I'll start recording. 1 second. All right, ma'am, whenever you're ready.
Okay. All right. So half a day, everyone. The latest report that we have right now is that we have 812 case count, uh, 373 of active cases, four currently hospitalized, new assigned cases of 25, community testing, we found 3 new cases for contact tracing, 22, and case travel 0. For case investigation, there is 25 in progress right now. So right now at this point, there also PUIs were tested, 31 were tested and 22 positive. This is coming from the CDI report. This is a or communicable disease investigation inspection report. There's I guess the purpose of today really is about sending out the message again about getting vaccinated. What we're seeing right now is that more individuals are having severe symptoms, and these are all unvaccinated. The ones that we are seeing for less severe symptoms, they are the vaccinated. And so at this point, I don't know what to say about the messaging really if we can try to convince others to get vaccinated and especially masking up. The question that was asked a while back was, or the last presser that we responded to was about individuals, about the cluster. Is this a cluster? Any connection with the cluster? It's already widespread. We can already see that. It doesn't really, it's not targeted against a population. It's not targeted against just a one congregation. It's really, we are seeing it all around. But we are also seeing the effects or how vaccination works, at least with preventing hospitalization and severe illness. So we are now reporting the vaccination progress that we are seeing on a daily basis. On Saturday, to get 600 individuals in. Those are our numbers like early on when we started rolling out vaccinations. So to see that numbers, that individuals are coming in and hearing our call to get vaccinated. So we appreciate that. But we also want to continue to ask people to mask up. The most vulnerable time when you can get infected is really with hanging out with your friends and your families in a setting where you don't have a mask on because they're your friends, they're your families, and you don't put on a mask. But unfortunately, that's where it's spreading. I appreciate the schools reopening with mitigation efforts in place, with masking, with testing, and with barriers of social distancing to allow that to happen. So there's a lot of things that I just want to, again, the purpose of this media conference is really to answer your questions, but also to share with you what we're seeing. We are seeing a lot of cases, which is in a way, it's good that we're finding them, and it's good that we're placing them in a quarantine site where with medical attention available. to ensure that they get the treatment necessary, especially with monoclonal antibodies. It is critical to provide the treatment in a more prompt manner and be able to get them the treatment as quickly as possible. So anyway, that's really what it is. I just wanted to answer questions. Of course, I know there's a lot of things in your mind, especially with continuous findings of positive cases. Gil, did you want to add on anything else?
Nothing other than we'll be sending out the report later on today, folks. And if you have a question, please raise your hand and I'll call on you. First one, we have Tomas. Go for it.
Hi, good afternoon. Just wanted to ask about the those four hospitalized. Are you able to provide the age range and the status of their hospitalizations?
Um, what we can do is, well, I would say that as young as in the 50s, I would say that. I'm not going to get into more detail because they are hospitalized. Of course, there's HIPAA concerns and privacy concerns. And this is a small community. So, identifying that, providing that identifier can put an individual to be identified clearly out that they are hospitalized. And that is not something we would do.
Are you able to share the status of these individuals?
They are very. It's basically serious. There's low oxygen that we're working to try to make sure that they recover from it.
Would you say that some of them are receiving an ICU level of care?
Yes, they're all ICU level of care.
All right, and I wanted to ask about the ACS. Is that being warmed up, or what's the?
Oh, no, sorry, I'm sorry. I'm confirming because I believe I'm trying to get some more information, but I believe there's two more that have been admitted there as well.
So a total of how many hospitalizations?
Um, I believe it's an observation status for the two at the ACS at this point, but currently right now we had four COVID units, and they're all occupied by the four that are hospitalized.
So those who are hospitalized are at ACS and not at the CHCC.
Correction, no, they're hospitalized at CHCC or the CHC hospital, and those that are at ACS are, I have to verify on their status, but right now I'm waiting for verification, but they are on at least observation status.
Okay, but it still remains at 4.
Yeah, we can just go ahead and just call it at 4, Tomas.
Okay, just wanted to make sure we report the right numbers. And I just wanted to also just ask more CEO about your message about social gatherings. It almost sounds as if you want more self-imposed, almost like a self-imposed lockdown of sorts. Um, what's your suggestions to those who still have to go to work, schools are reopening, quote unquote normal life is going on? How in addition to the 3 Ws, how do you just navigate that situation given that we're seeing more of these cases? Is it a matter of stay within your household at least for the next 2 weeks or more, or what exactly is the tangible thing to do?
Well, the tangible thing to do is that, first of all, there's public health mitigation measures that are available, and that's one of the things that we shared for many conversations here with the media is, get vaccinated, wear a mask, watch your distance, and wash your hands. Those public health measures are, still work. There's for in regards to staying at home, no, that's not what we're saying. We're not saying it's a lockdown. It's basically, if you are going to be in a gathering, that you need to be, be sensible and make sure that you have your mask on, because while you may not, again, the protection is not only on yourself, but it's a protection of others, especially if you have some family members that are unvaccinated, and that's what we're seeing.
And in terms of boosters, is that also part of the campaign in terms of getting? We're obviously seeing waning immunity, right? At least after 6 months, is that also something of priority to get out into the community to get their booster shots?
Yes, yes, absolutely. And we're seeing a high number of individuals coming in to get their booster shots. So we're urging everyone, if you're eligible for it and you're within that time frame for within the waning efficacy, of course, of immunity, you want to be able to make sure that you get you sign up, or you walk up to the vaccination site and get vaccinated for the boosters. And they will, of course, it's always, if you want to talk to your doctor, that's also urged for you to do as well, if you want to do it before you sign up. But we it's available. It's available for anyone who wants to get a booster.
Right. Thank you.
Oh,
That's it.
sorry. Let me clarify. It's available to anyone who's eligible for it, which is basically 18-year-olds.
All right. Thank you.
Thank you.
Thank you, Tomas. And I just want to give our media partners a heads up. Yes, we'll be including in the next release some CDC guidelines on how to protect yourself during these times. Sally, go ahead.